Howdy folks, John Adamson, the Rehab and Documentation Guru, sitting in my car getting ready to soon present my neuromuscular reeducation course for Allied Health Education. So if you haven't checked out Allied Health Education, I have a number of courses with them. I really like the couple who runs it, Tom and Cindy Davenport. They've got excellent selection, a lot of great courses, excellent speakers, and I'm very happy with my partnership with them. So recently, I've gotten on X platform, formerly known as Twitter, with the Rehab and Documentation Guru. Yes, I'm a little bit slow to adopt that for business purposes, but it is what it is. So for the last 2 months, roughly, I've been on there and started to connect with people who are maybe movers and shakers in the therapy world in general. And one guy I happened to stumble across is... I forget his name, but PT Pintcast. He actually has a YouTube channel. He has an X platform presence. He's obviously been there for a while. And he does podcasts. In fact, he has really nice setup. High quality. Much better than mine. I mean, look at my surroundings. And he has a microphone and everything. And he, like I, has done some interviews. And in fact, it looks like, and I haven't looked deep into his platform, but he does a fair number of interviews, but he does a lot of short takes. He obviously has interests beyond therapy, and he asks people to critically think about other things that might, propel the profession of therapy. With that said, he had posted something about whether therapists viewed physical therapy as a profession or as an industry. And fortunately, most people, I think it was like 87% polled, said it is a profession. I was one of those. But I said we might want to ask the same of the APTA leadership. And he's proceeded to ask me a number of questions, good questions. But frankly, I don't have the time to type all my response related to that because I have a lot to say about that. One of the things I've covered in the past is the DPT program. Is it really necessary? And my answer is no, it's not. And for good reason. I actually did a fairly long video about this roughly 3 or 4 years ago. You can find it on my channel where I break down the actual coursework needed to get a DPT and why it's not necessary to get a doctorate. In fact, you could fit all that coursework easily into a bachelor's program and reduce the amount of expenditure by the student. So one of the things I have been concerned about as the APTA developed in around 2000 and adopted Vision 2020, which was that by the year 2020, all programs, entry-level programs for therapy, PT, would be doctorate level, entry-level doctorate. And we do know that that's realized now. So that is the entry-level program in the United States, according to APTA, which is the accreditation arm of the American Physical Therapy Association. They may say that they have different governance and they are perhaps run by different people, but they are very much related. And really the only entities that each state, which does set the basic guidelines for licensure, the only entities that each state listens to in reality is APTA and APTA. There is no competition whatsoever in the world of therapy in the United States to suggest alternatives to entry level into physical therapy as a physical therapist. And so APTA came up with the Vision 2020, and that was a significant component. One of my concerns related to that is that, one, it was an unnecessary expansion of the amount of schools somebody needed to go to become a qualified physical therapist. Now, part of the reason, the rationale was to be a primary caregiver entry into healthcare for some patients. So, for instance, a lot of states have regulations that allow for direct access to a PT, but they usually have some rules and regulations that stipulate what patients can go to a PT. But let's just say for lack of for ease of discussion, we're talking about just simple, like a musculoskeletal strain. So the patient has a musculoskeletal injury, and they know it's probably just like a pulled muscle, or it's a sprain, or strain, whatever it might be. They can just go to somebody that is a movement specialist, like a PT, and get evaluated, get screened for what are some other possible medical things that need to be attended to by a doctor, and then probably get effective treatment to address their back strain, sprain, ankle sprain, whatever it might be that's musculoskeletal. So that's just like a very simple overview of what direct access could look like. And so the APTA's understanding was that if we created individuals who had a doctorate level education, then perhaps they would not only push the narrative that PT is worthy direct access caregiver in the world of medicine, but also have the cred, in other words, doctorate of physical therapy, that allows the general populace to trust us. What ended up happening, though, and it's partly related to the reimbursement world, which is not going to get better anytime soon, and maybe we'll investigate that in a future video, is that you created a situation with the ever-increasing, like outpacing the national cost of living increases. You have this tremendous increase in the cost of an education. Just to give you an idea, and the reason I know this off the top of my head is I just looked into this the other day. Somebody from the APTA, Mabry, I think is his last name, he's a fellow of the APTA. He posted on LinkedIn that salaries are significantly increased for PTs. There's a false narrative saying that salaries are not increased for PTs. And he compared 1988 to the current year, or 2022. And I guess that was the last data that they had that was solid. And so from 88 to 92, or 2022, it was determined that there was a significant increase in salary. And that is the case. But when you look at other factors, the amount of increase in salary has not offset the cost of living. We've not kept up with the cost of living. And one of the big factors related to that is schooling. So in 1988, the average bachelor's program graduate had roughly $9,500 in debt. When I graduated in 91, I had about $8,000 in debt. So I wasn't too far behind, but that was the average, $9,500 in debt in 1988. In 2024, the average DPT, program graduating therapist, has a debt of $150,000. There was another study that showed about $142,000, but that is astronomically higher than what was previously back in 1988, and at that point you have a bachelor's entry-level degree. Now, one of the things that we could say definitively is even if you didn't do a DPT, a bachelor's program might set you back quite substantially as well, but nowhere near the level that a DPT, which is almost double the amount of school that somebody could do for a bachelor's degree program. So what has happened? We are graduating people with a doctorate level degree, which is costing them a whole lot more in a very much cooled environment in terms of like hiring people, which with a much higher cost of living. And we're making it impossible for them to find jobs where they can distinguish themselves, for one thing, to get paid more. And we don't have the job market to basically enact or effect increases in salary. So right now, the average salary of a therapist is just a little under $100,000. That's average PT salary in the United States today. Well, $100,000 doesn't go nearly as far as it used to. And so when you compare that back again to 1988, and then you throw in $150,000 in debt on top of that poor student, they're basically paying a house mortgage already before they even buy a house. And houses on average are about 4 times the cost they were in 1988. this little comparison by Dr. Mabry really isn't telling a good story. So anyway, back to the APTA. What is one of my concerns about the APTA? By pushing for the Vision 2020, the APTA created a situation where people come out of the entry into PT is so much more cost to a student, a good student, that these good students are looking at other careers that they go the same amount of schooling and get paid substantially more. If you look at nurse practitioners and physician assistants, for instance, who have comparable to DPT education, they are making substantially more on average than typical PT, doctorate PT. The other, another field to look at would be like a nurse anesthetist who makes even more. Some of the nurse anesthetists are coming out of school making double what a new grad PT is making. Same amount of school, but making substantially more. And in PT, unless you're really promoting yourself as an independent practice, and you're working really hard to make those Benjamins, as they say, you're not going to make nearly the amounts that a PA, NP, or nurse anesthetist is going to make. I was going to say something else related to that, but it just flew the brain, unfortunately. But anyway, so that's all I'm going to cover for today. But that is definitely related to my concerns about the APTA. That they've created this deficiency in the brains that are trying to go into the field of PT, because the real smart students are saying, why would I get a doctorate when I can in PT when I can make a lot more in these other fields that still have substantial need? And I think really, I don't see us going backwards, obviously. Unfortunately, the typical tendency of a singular controlling entity, whether we're talking about our national government or we're talking about the APTA coupled with CAPTA, is that they're not going back. We're not going to go back to an opportunity to see entry-level PT being like a bachelor's degree, which I do believe is completely possible, and then distinguishing doctorates of PT, maybe in a specialty area, who now, because of their specialization, have opportunities to make more, to justify the increased cost, and maybe they go on to become the educators in the different schools or whatever they want to use their doctorate for. But we've raised the bar for entry too high to make it really viable for PTs of the future. And we're going to just see tuition go up and up and up. And so we're gonna really get a lack of really good qualified candidates going into PT, and it is in large part because of the push by the APTA for Vision 2020 entry-level doctorate. Because when everybody's special, nobody's special, and that was said by Syndrome in The Incredibles. So there's my movie quote. Disney Pixar quote for today. Anyway, that's all I've got for this video. Hope you're doing well. Like, subscribe, comment. What are your thoughts? And I'm going to now start getting ready for my neuromuscular reeducation course tonight, 8 p.m. to 10 p.m. Eastern Standard Time through Allied Health Education. Hope you have a good night. Take care. God bless.